to Face Turkey. This is Soror Alam. We have three guests. Today we have three guests from three different countries. We have Dr. Zahra Ali from Kenya, Dr. Muhammed Jaiteh from Gambia, and Baba Osman Bukari from Ghana. All of them are from three different countries, but they have one common thing. They are graduated from Turkish universities. Now they are in three different countries, and we will talk to them about their life and their profession and their future. Again, welcome to Face Turkey. And let me introduce my guests. First, I want to introduce Muhammed Jaiteh. He's from Gambia. He came to Turkey in 2006. He received Turkish government scholarship, and he studied medicine in a university in Turkey, and now he is working as a doctor in a private hospital in Antalya. And we also have with us right now Dr. Zahra Ali from Kenya. She received Turkish government scholarship long back, and now she is doing a tremendous job in her country. We will introduce her also later. And now we have Baba Osman Bukari. He is from Ghana. He received a scholarship from Turkey, and he came to Turkey in 2013 for undergraduate study, and he studied at Istanbul Commerce University. Now he is in Qatar. Welcome to Face Turkey. Let me start with Mr. Jaiteh, Muhammed Jaiteh from Gambia. You received Turkish scholarship in 2006 when Turkey was not that type of famous across the world as Turkey is now. So at that time, about 15 years ago, you choose to study Turkey. You select to study Turkey, and you decide, and you came as a teenager. I think it was very difficult to decide at that time, and you came to Turkey, you studied here, you did your medicine doctor study in Turkey in Hacettepe University, in Hacettepe University, and now you are a specialist doctor. So what forced you to choose Turkey at that time?
Thank you very much, Sowat, for having me in your program. That's a very difficult question, but to be frank, when I decided to come to Turkey, or when the opportunity to travel to Turkey and have my studies here came up, I never took it seriously, because, I was, like many other students during my time, was looking for an opportunity in Europe or in the US, but when I look at it properly, I just decided to take this opportunity up and then come over. Looking back, I think it was a right decision because I had the opportunity to complete my medical studies and go further to do my specialization. So basically, it was a difficult decision because I never, I didn't have much knowledge about Turkey, about what to expect, about the Turkish culture and the language. So basically, I just picked my luggage and then came to Turkey, and it was an adventure, I would say.
Yes, you completed your Doctor of Medicine study in 2013. Then in 2014, you started PhD in Public Health at Hacettepe University in Ankara. And then between 2015 and 2019, you completed your clinical specialization in internal medicine. And after that, you started your professional life in Turkey, and now you are working as a specialist in internal medicine at a private hospital in Alanya. So under this coronavirus pandemic, under this situation, I know that doctors are the frontline warrior. And you are working in a country where you did not born, but you are working here with Turkish people. You are giving your service with Turkish people under these circumstances. So can you explain us about a little bit more about your current job, how difficult it is and how long you are working under this situation in your hospital and how is going on everything?
Okay, yeah, I think that's a good point. First of all, I have to say that working in Turkey as a foreign doctor, especially someone from Africa, it's not an easy thing, But despite all the odds, yeah, I think I've settled down quite well since I completed my specialization studies. And well, with the advent of this COVID-19 pandemic, this is a global problem. It has affected everyone, everywhere in the world, and so it's a common problem. It's a common threat, and it's affecting everyone regardless of what you do or where you come from. So we had to fight this pandemic, side by side, in consultation, or let me say, in concert with everyone who is in the health sector. So we do our best as health workers, first to sensitize people on what this pandemic is, because you have a lot of misinformation going on about. But more importantly, we try to give clinical care to people who are inflicted with the disease. So it's a hectic job. It's not an easy one. It involves a lot of risk. As you know, a lot of health workers are contracting the virus. A lot more are dying. But then, it's a war that we have to continue fighting.
Yeah, thank you so much. Yes, you are doing a tremendous job there actually under this coronavirus pandemic. I know you face big difficulties actually to manage your hospital work, and after that you come to your family, and you need to maintain some social distancing more than other professional other people from other profession. I will ask you about this later. Let me talk to Dr. Zahra Ali. She is joining us from Mombasa in Kenya, and Mombasa is a coastal city of Kenya along with Indian Ocean. So Dr. Zahra Ali came to Turkey in 1987. 1987, a very long time ago, she came to Turkey, and I think it's at that time it's really very tough to travel to Turkey from Kenya, especially for a girl at that time. And then she completed her medicine at Hacettepe University in Ankara, and then she did a tremendous job across the world, I can say, and especially for Kenya. So let me ask her what she is doing now in Kenya. Ms. Zahra Ali.
Yes. Inviting me. I'm very honored to be among you. As you say, I completed my work in I completed my school in 1996 and worked almost everywhere with different organizations, including Doctors Worldwide. That is where it enabled me to travel to a number of places. And in 2014, I came to Kenya, and from then on, I've worked with TIFA here in Kenya. I have worked with different NGOs again, with Yerius Dr. Lar from Turkey. That's the Doctors Worldwide version of Turkish version. And I'm also currently working with TADA, which is a private entity and agency. TADA means Turkish African Business Development Agency, and we are working as a bridge between Turkey and Africa. Of course, meanwhile, also with Green Crescent, we established Green Crescent Society of Kenya. I'm the founder and the president, and also the Turkish Graduates Association in Kenya. Again, I'm the president. So we work with I work with a wide range of associations here, with institutions, because being a bridge between Turkey and Africa, I'm the African coordinator. I travel a lot, apart from this year because of the pandemic. My last travel was from Malawi in March, and I came back to face a number of health challenges as well, but it's good. I'm also a member, executive member of WIHU, World Islamic Health Union. So my life is good. It's not bad. I'm very busy and a good network.
Yeah,
Yes.
so a lot of work. I mean, you are engaged with a lot of associations and organizations and institutions. Is it easy
Yes.
to manage all things after doing, I mean, after end of the day? What do you think? I mean, how did you manage all these things?
Actually, all this is, I'm able to do it because of teamwork. I'm not doing anything alone. And wherever I go, for example, from Malawi, we have a team on the ground. In Sudan, we have a team on the ground. In Ethiopia, we have a team on the ground. And in Turkey, of course, I started learning how to do teamwork and organizations in Turkey when I was a student in 4th year. And when the first organization for foreign students was formed, that is the Society for International Research and Friendship.
So
in
what
Ankara.
kind of...
I was only in 4th year at that time.
Okay. So what kind of groundwork you are doing right now? I mean, what kind of field work you are doing in Kenya and other African countries? Tell us about your works. What kind of work you are doing there? What kind of facilities you are providing to the local people there?
We can divide it into two.
Yes.
Of the NGO work, we are empowering the youth, widows, and the vulnerable people who against addiction. That's where Green Crescent comes in most of the time, against addiction. We give awareness, we give training for different opportunities for them, and we also work in collaboration with the local NGOs and hospitals. One of the major hospitals we work with is MEWA for rehabilitation whenever necessary. But Green Crescent is also connected with a number of Green Crescents all over Africa and in the world. As you know, Green Crescent was from Turkey. In 2014, back to Kenya and realized there was a lot of addiction. I came to Turkey and asked them if we could form a Green Crescent in Kenya, and that's part of a number of other Green Crescents. So we work in collaboration and do joint projects. Also, when it comes with Turkish graduates, we have a number of doctors, we have engineers on the ground, and we collaborate on different projects together. That will link me to the business side with being a Turkish graduate and the new network which has come up with Turkish graduates associations in many different countries. It means I have a network in almost all those different countries. So we connect business-wise. Whenever somebody needs something, they let us know. As TADA, which is Turkish African Business Development Agency, we assist them. We get the information from them. What do they really need? How can we make it into a viable project? Go back to Turkey, get the stockholders, appropriate stockholders for that project, bring those two together and add funding if it is necessary, and we take off with the projects. So it's a range again, ranging from small projects like small grassroots to government projects, energy projects, agriculture projects. It's a lot of sectors. So we are very lucky because Turkey was actually a developing country, but on the higher end. We went through all those development stages which Africa is undergoing through. I was lucky to go through all that. So I can see exactly how to move with the African population or the African needs to find a suitable partner and pair them up and help them grow. So we do a lot of consultation.
As I understood that you have acquired a lot of experience, especially from Turkey and Turkish institutions and organizations, and currently you are sharing that experience not only with the youth in Kenya but other African countries. That's I think, a great initiative, and you are working with NGOs and business associations, and also you are a doctor, and you have a huge number of doctors in Kenya who graduated from Turkey. Yeah. Now let me talk to Mr. Baba Osman Bukari. Baba Osman, you are from Ghana. You came here in 2013. You studied at Istanbul Commerce University, and now you are in Qatar. What are you doing in Qatar? Let me ask you, friendly. What are you doing in Qatar, man?
So I came to Qatar to pursue a master's in Islamic finance at Hamad bin Khalifa University. So this is my second master's. Yeah.
Yeah, this is your second master's. I mean, you are in Qatar and you studied in Turkey. So when you were in Turkey, what kind of activities and networks you were joined during your stay in Turkey?
Okay. First of all, thank you very much for hosting me in your program. I would say I was a bit fortunate, if I can put it like that, compared to Dr. Zahra and Dr. Jama.
Jaiteh.
So I came to Turkey in 2013, where there was already a lot of foreign students coming to Turkey. So they had established like international associations. So like Sadar, Bab Alem. So in 2014, they established Turquoise International Association. So based on where I was schooling, Istanbul Commerce University, I was going to Turquoise. So I learned a lot. I took up leadership roles. I learned a lot of leadership skills and organization skills from there. So from there, when I graduated, I was once the African president, the student representative. When I graduated, TUMED has been formed. So I worked like as a volunteer 1 year in TUMED. So because of all this association with these institutions, I kind of have passion to do volunteer work and humanitarian work. That's why
I mean, let me clear it to our audience that you, after coming to Turkey, you have engaged with so many international students organization while you were a student. After graduated, you were a volunteer with the International Alumni Association in Turkey, based in Istanbul, right?
Yeah.
So all these volunteer activities, especially during your student life, lead you to do work with people, with local people, or we can say the work with international students, and it give you an opportunity to widen your network, a huge network across the world, right?
Exactly. And to add also, I started my own organization back home, where we kind of help the people in the deprived communities, people in the interior. So we kind of doing humanitarian arts work as well, like digging of wells and sending food to the people in deprived remote areas of Ghana. So it's based on my association with these institutions that I got to have that passion and know how these things are done.
So this is your own organization, right? Own organization. Yeah. That organization is working for Syrian people.
No, we are working for the Ghanaian people in the remote areas, like
Ghanaian people in the remote area. Yeah. What kind of support you are providing for the people in remote area?
Some people, they have very difficulty in accessing drinkable water.
Yes.
So we dig in boreholes for them.
Wow.
Yeah. In Ramadan also, we distribute food packages to them.
So from where you are getting the support, I mean the monetary support or donations, from where you are getting this type of donations?
Yeah, mostly from my friends, my Turkish friends that I have from Turkey and also abroad. Like when I was in Europe, the Turkish friends that I made in Europe.
So till now, how many people were get support? How many people got support from your association till now? Can you give us a figure, a number, a total number?
Yeah. So in the past Ramadan, the distribution that we did, we were able to reach about 800 people. So, but the number of wells, because before we weren't doing the wells, we just started the wells and we have done 12 so far. During the pandemic, when I went home, we did 12 wells.
Okay. Baba Osman Bukari, at this early age, actually, you have established an organization to support the local remote people in your country, especially to give them water supply facilities and also some kind of humanitarian activities and support. As you are currently, you are a master's degree student in Qatar, but that did not stop you from working for local people, for the needy people. And I think you have a brave heart to work for your people. Now let me turn to Mr. Jaiteh again, Dr. Jaiteh. As I told earlier that you are one of the frontline warrior, and you are living with your family, and you have a kid there. So, what is your work schedule? What kind of tough schedule you are facing right now? I mean, how many days in a week you are working, and how many hours you are working in hospital?
Okay. Well, as a medical doctor, basically we work around the clock, So even if you're not on site, physically, even when you're at home, you're still working, because you have patients who are admitted in the hospital that are under your responsibility. So when you've been contacted, and you sometimes have to report back to the hospital at any time, when there's an emergency. So basically we work around the clock, but then officially, we work on weekdays and on Saturdays. So the only rest day that we have is on Sundays.
Yeah. Work around the clock. Yes, this is I think the most important word right now. The world is hearing from doctors. You are here for more than around 15 years, and you have a profession here. You have a very good profession here in Turkey, in a very good environment you are facing with your family, and under this, this coronavirus pandemic maybe make your life a little bit difficult like other people, but in Turkey you have a very good life. So what is your plan in future? Do you want to stay in Turkey, for long? What is your future plan? Can you explain it?
Yeah, so I finished my specialization in internal medicine just 1 year ago. So my aim was to have some clinical experience in my specialized area of specialty, and then go ahead and do further specialization in the area of internal medicine, because if you look at it properly, internal medicine is one of the biggest branches in medicine proper. So you actually have a lot of sub branches, what we call subspecialties, that sometimes people go for and specialize in those areas. So my long-term plan is to become a nephrologist, specialize in nephrology, which is kidney diseases, and in the long run go back to the Gambia and then start serving my people as a specialist in both in internal medicine and in nephrology. And one major motivation is because I know for a fact that a lot of people in the Gambia are having chronic kidney diseases, and most of those people proceed to become dialysis patients. And access to dialysis care in the Gambia is not very easy. And if you look at the growing number of patient population, and considering the projections regarding non-communicable diseases, including high blood pressure, heart diseases, you would expect a lot more people will become dialysis dependent, in the years to come. So basically, my plan is to become a specialist in nephrology and then go back to the Gambia to serve in that area.
So your ultimate goal is to go back to Gambia and serve the people there.
Yeah. So exactly. Like the other guest talked about, what it's not just about clinical service. Dr. Zahra talked about the extensive, let me say, responsibility she has.
Yes.
So that's something one should emulate definitely. I would like to congratulate her for all the good work that she is doing, and look forward to maybe networking or partnering with her, in trying to expand the service that she's
this
providing.
television program can be an opportunity for doing that partnership also. Okay, we can
exactly because
we can facilitate that type of ground
I try
to have
to
a
do
partnership.
some social services, social work, that is not just let me say related to medicine, non-medicine associated, or let me say related services, including social services, charity work, like the brother from Ghana is doing. So these are things that I've also had to develop my experience when I was in Turkey. Because when I came in 2006, basically there were no Gambians. So over the years, I saw that like a lot of Gambians have the number started to increase, and a lot more students were coming from other neighboring countries. So we formed our own association.
Now, Mr. Jaiteh, we already know about your plan. You have explained all these things, and you have a very passion to go back to your country and serve for your people. Under this coronavirus situation, let me ask you only a single and a short question, just a short question. As you are a doctor in Turkey, and Turkey is facing also the coronavirus pandemic like any other countries. So how do you see the way Turkey is fighting against the coronavirus pandemic?
I think Turkey's fight against the pandemic is exemplary in many aspects, because this virus is something that's new, and no one knows how to fight it properly. But if you look at how things evolved since the beginning of the pandemic, especially with regards to patient diagnosis and contact tracing, I think Turkey did a lot of a good job in that. If you look at the test capacity, you talk about over 150,000 tests done a day.
Now actually it is over 200.
Yeah, so it's increasing it because the private sector is also coming up. It's not just the government that is testing. The private sector is also helping out. So it's I think we definitely have to commend the Turkish Ministry of Health for the good job that they're doing, especially with contact tracing and isolating those who have high risk of becoming infected or who have the virus.
Yes.
So, which is like an important key step in controlling the pandemic.
Yes. I also know that, like Mr. Jaiteh, there are hundreds of international graduates who completed their study in Turkey and work as a doctor in different Turkish hospital, with government and private hospital also. They are also doing a tremendous job in this coronavirus situation. They are also a part of Turkish fight against coronavirus. They are also a part of that warrior team. Thank you so much, Dr. Jaiteh. Now, Ms. Zahra from Kenya, you are there right now. You travel from country to country, and you are the bridge between Turkey and Kenya, a very strong bridge. What is your, message to the new people, to the new student who came to Turkey for a study, or who want to come to Turkey for a study? What is your message to them?
Yes. Thank you very much for this question. This question is very important, actually, and it also is included in some of our work. Now, when I came, there was a period of time in 1993, in 2003, when I came back to Kenya for a period of time, and I traveled Kenya, Tanzania, Uganda, and Democratic Congo. That's the time I realized Africa needs to have more trained people in all sectors. So with the new student, I would like to tell them that they are very lucky to be in a time whereby Turkey is not only even more developed, in fact, more developed than many European countries in many aspects, especially in medicine. We see a lot of flow of health tourism coming in from Europe, coming in from America, as far as America. The health system in Turkey is really actually very the foundation of the health system. I'm sure my doctor friend here would tell us even more. He's right in the heart of it. But from outside, you can also see it. Not only very good, the prices are very good. Leave alone health system. We have got a very good education system as well. It's not only theory. You find in some countries like Russia, when the students go, they have just theoretical hands-on. But in Turkey, the same thing which the foreigners also get in terms of education and training in all sectors. So with this in mind, I would like to tell our friends who are there right now to take the opportunity. In my time, we did not have all these other students' organizations which were able to organize events, which were able to introduce you to some other places, which were able to solve your problems in case you needed some assistance or you needed information. Everything is available in Turkey. Not only the students themselves, the government under Jaiteh is also doing a lot of organization, a lot of training. And together with Turkish graduates associations all over. So I would advise the students to take the opportunity. Turkey is the land of opportunity. Everybody is talking about America. America has got its own very difficult things, and it's expensive in America. Turkey has a lot of opportunity and not as expensive as America. Right now, with an association here in Kenya, we are sending students abroad to Malaysia, to Ukraine, to Europe, and to Turkey. The best prices of the fees, where the fees is involved, and the life standard, high life standard at an appropriate price is in Turkey. People like me, okay, I studied my undergraduate. I did some programs in psychosocial specialism, but there is no age cutoff in Turkey. So anybody who has done any training can go back again to Turkey, and they have the opportunity. And Turkey is actually a very hospitable place. There are associations to help you. You are a new student, you have the old student group which will be able to assist you, to welcome you and assist you. If you're in Turkey, get in contact with the associations. Get active. Don't just become a bookworm. Get active, because it is through the activity that you get the experience. And also get in touch with your Turkish Graduates Association back home, because when you go home, you will need somebody to help you. You know, many people don't understand Turkish graduates, I can say, because when we're in Turkey, we develop a different culture. It's a mixture of our own initial culture back home and a Turkish culture. So when you go back home, the first time when you come to Turkey, don't know anything, you might get a Turkish cultural shock. And after graduating, after living in Turkey for long, and you go back home, you will find that you will get another cultural shock if you're not in touch with people who can assist you. So please, my friends, grab all the opportunity. I congratulate both brothers here, because that's exactly what they did. There are many people who go back and get very frustrated, and they cannot adapt to their own system. They cannot adapt back to their own culture. But if you keep in touch with both sides, you will be able to adapt, and you will be able to do a lot of good things. So in short, I would like to tell the students, student life is the best life. There is not much responsibility. So use that time to gain all the experience which you can. Use the time to travel in Turkey. Many countries, when you're a student, you cannot travel. But in Turkey, there are many discounts.
Yes, this could be a very good message.
Opportunities
yes,
and
this
travel.
could be a very good message for graduates. I mean, who graduated, for international students who graduated from Turkey and who will be graduated from Turkey. This could be a very good message that almost every country there is alumni association. Almost every country. I mean, the major countries, they have alumni association, and the students and graduates who go back to their country can join and work with that organization, alumni association, and that would be a very good opportunity for them. Thank you so much, Baba Osman. So now you are head of an organization, and that organization is doing tremendous job. But I think under this coronavirus pandemic, you are facing a little bit tough situation also in your country. So what is your future plan with that organization?
I have actually started my journey. Oh, sorry.
Sorry.
I had lost contact a bit, so
sorry. Due to this technical, we are very sorry due to this technical situation.
No problem.
Actually, I was asking to Baba. I was asking to Baba Osman actually about the future plan with his organization. Yes, Mr. Baba Osman.
Yeah. So my plan for the organization in the future is, for now, it's only in my district, because we don't have much resources. We're trying to help the needy people in my district. But I hope in the future I can expand it to other places, remote areas, districts all over Ghana. So yeah, that's basically, I want to expand it to help as much as more people as I can. And also to expand the variety of works, like to extend it to, in terms of education, like providing scholarship to students, or like giving them some consultancy services for free and other stuff.
So you provide a scholarship to students?
No, for now we don't provide scholarship, but I hope in the future when we expand the organization,
yes,
so that we can provide scholarship to students, to give them free counseling advice. Yeah, but for now, no.
A great aim and target, I can say that as a student who got a scholarship from other country and now establish an organization and plan to give a scholarship to other needy people or other students who could be a very good asset for his country, and you plan to reach all needy people in your country. I only can pray for you and hope the best for you, I think. And Mr. Muhammed Jaiteh, in Gambia, I know that Gambia is a small and very beautiful country, and you want to go back to your country and serve your people. And what kind of bridge or what kind of relation currently there is existed in between Turkey and Gambia, especially in medical field? Can you explain a little bit?
Okay, that's a good question. Well, I can say the relationship between Turkey and the Gambia, actually it dates back to the 80s. I think, in fact, Gambia is one of the first African countries to have official diplomatic ties with Turkey. And in the 80s, Turkey was training Gambian soldiers, Gambian police, and that actually continues until today. And so apart from that, you also have relations in the sector of education, health, and trade as well. So in terms of health, which is related to my area, I can say for sure that Dr. Zahra talked about health tourism that's going on in Turkey, and I can say for sure that there is an official link between the Turkish government and the Gambia, that through which program patients are being sent from the Gambia to Turkey to receive specialized training, specialized treatment. And as part of the same package, medical personnel also benefit from training that's also provided by the Turkish government. So, not to talk about the students that also benefit through the Turkish scholarship and short training packages, from time to time. So basically, in terms of health and other sectors, you have a long-standing link between these two countries, and there's room to improve that.
Yes, that's a good plan, I think, and also I hope that you will also establish that kind of strong base that Sister Zahra and her team has already they have already established between Turkey and Kenya and other countries. I also think, I mean, as you said, that Turkey and Gambia has strong ties, especially in bilateral relation, especially in military field and also in medical field. And you can be one of the influential person who can improve this relationship and take this a step forward.
Exactly.
Yes. Yes, you can continue.
Okay. So when I was a student, and up until now, from time to time we get involved in projects that are basically designed to support the healthcare system in the Gambia. So over like several years ago, we had a project with TICA to supply or to build the capacity of 5 different healthcare services that this project was designed by students like myself. We had our own student organization for Gambian students, so we came together, we programmed this project, and it was a success, so the Turkish government through TICA was able to supply 5 different hospitals in the Gambia with basic consumables and advanced medical equipments like ultrasound devices and so on. So this was one step that we took, and subsequently, we're able to take part in several other projects, some of which were basically to provide, to increase the capacity of medical staff. And as I speak right now, we have a few other projects, which are in the areas of capacity building and improving the human resource capacity of the government. So it's not easy to be able to do certain things, when you are not on the ground in the Gambia. But I still believe, one can do something even if you are not on the ground.
Yeah, really, it's not difficult. It's not easy to do something actually when you are not on the ground. But as Sister Zahra, she is on the ground and she is doing her best to support the people in her country and the neighboring countries. Sister Zahra, what is your future plan? I mean, you told us that you have a lot of work. You already, I think you don't have any boundaries like now. So what is your future plan? Where do you want to take this work in near future?
Yes. When I was in fourth year, before I started getting involved in the NGO work with the association, my dream was for us to be able to have a network all over the world, because I realized a lot of students are graduating back to their countries, they're becoming prime ministers, they're becoming ministers in different sectors, they're becoming strong business people, politician people, but there was no connection. And alhamdulillah, right now you can see there is a strong connection going on. So my plan is to also get in touch with my two brothers here, and we continue the work and strengthen it. Doctor, you are very right. If you are not on the ground, it's very difficult to work. But I'm sure now you have graduates from Turkey who have gone back home. So that would be the best method. Because if you've not undergone what you have undergone, that do not see your dream. But when you have your fellow students who have graduated from Turkey, it is much easier. I would like to strengthen the bonds, the bonds between us. I would like to strengthen with other different countries all over Africa. And maybe we can come up with an African Turkish graduates platform, whereby we can share all the similar projects we have. We can share the good practices with each other, and together with assistance from Turkey, transfer of knowledge, and Africa. It is time for Africa. So far, Africa has been filled with a lot of things, but we have not had the opportunity. Now is the time for Africa to grow. Now is the time for us to learn more and to be able to contribute not only for ourselves, but for the world. Africans, we are so much used to getting assistance, but not growing ourselves. We need to teach our people to fish, to fish instead of getting the fish. We have to teach them how to fish. And we have to be part of the activities on the front line. There is no resting. And my other brother, I will tell you, there are many associations in Turkey right now you can get in touch with, who will be very glad to assist you, even in Gambia. There is Doctors Worldwide, which goes to Ghana. I know they have projects there. There's the Alliance of Doctors, and there are other associations which are working with water or with anything. But we also need to have, apart from this only assistance, know-how exchange platforms. And that is where I hope we will be able to go. Africa, open it for the Africans to each other to collaborate in information, in business, in marketing, in food security, because Africa is very fertile. We have everything in Africa. The only thing we are lacking is the know-how and the courage and to go after it, because we are so used to be given the donations and the aid. We have to change this mentality. And the only way is the youth.
Yes.
Our leaders
actually, as you
gone.
told, that now is the time for Africa. And also I can say that now is the time for Africa and Turkey to work together to strengthen their relationship and to work for a better Africa. And Africa has everything. Africa has youth. Africa has a new generation. Africa has educated new generation. Africa has enough resources to do work, and Turkey has know-how, so we can transfer that know-how to Africa. I mean, you can do that. And today's actually common ground was all of you are graduated from Turkey and currently working in 3 different countries, and all of you are doing your best thing for the people in your country. And I, as the host of Face to Face Turkey, I also hope that you will do a very good job for your country, for your people, and for the people of Africa, not only for the people of Africa, but also for the people across the world. I mean, for the needy people, for the people who are living in remote areas, and Turkey can be one of the center for that type of help and that type of work. Thank you so much. Thank you all for having with me, and I hope you will have a very good and pleasant and healthy life under this coronavirus pandemic. Thank you, and hope to see you in our next program.